Kaya Jordan, and I'm here today to present neuroimaging data from a phase 2 open-label study of NE3107 in patients with cognitive decline due to degenerative dementias. Over the course of this presentation, I'm going to describe a study that showed a positive signal for neuroimaging, neuropsychological testing outcomes, and fluid biomarkers associated with Alzheimer's disease and inflammation. Here are our disclosures. Before I get into the results, I want to give you some background information on BioVi's molecule. NE3107 is an insulin-sensitizing, anti-inflammatory small molecule that can get across the blood-brain barrier. It's derived from DHEA, a naturally occurring steroid hormone in humans. It's safe, metabolically stable, and orally bioavailable. NE3107 has been shown to decrease insulin resistance and inflammation by binding ERK and inhibiting NF-kappa B without disrupting any of their homeostatic functions. If you're interested in learning more about this mechanism, please refer to our references. As you can see, this was a hypothesis-driven study based on NE3107's mechanism. Here's what we expected to see, but I'm going to spend most of my time talking about the neuroimaging findings, where we expected to see changes in functional connectivity without any changes in structural connectivity or volumetrics. Our main goal was to look at changes in the brain MRI at baseline and at 3-month follow-up. Secondarily, we wanted to look at changes in cognitive functioning and fluid biomarkers related to Alzheimer's disease and inflammation. Here was our study design. It was designed to be a phase 2 open-label single-arm study. To be included, patients had to have cognitive decline due to dementia. They had to score a 0.5 or 1 on the CDR. 23 patients were enrolled in this study, and they were instructed to take 20 milligrams of NE3107 twice a day for 3 months. Data analysis from this study is still ongoing, but today I'm going to present what we have so far from the neuroimaging, clinical assessments, and the biomarkers. Here's some more information on the study population. The average age was 71 years old. 70% were female and 30% were male. One thing I do want to point out, to ensure that we included the intended study population in our data analysis, we broke down our study population into 2 subgroups based on the MMSE. One with a baseline MMSE score of 20 or greater, indicating mild cognitive impairment or mild dementia, and the other group with a baseline MMSE score of less than 20, indicating moderate dementia. There were 2 other posters related to this study presented at this conference, and I will summarize. At baseline and at 3-month follow-up, we assessed cognitive functioning with a variety of neuropsychological and cognitive tests. After 3 months of NE3107, we saw significant improvements in 4 of these tests. We also looked at an extensive panel of CSF and blood biomarkers. After 3 months of NE3107, NE3107 was associated with a significant improvement in phospho-tau and the phospho-tau to A-beta 42 ratio. Interestingly, we also saw significant correlations between several of these biomarkers and cognitive outcomes. I'm going to spend the next several slides discussing the imaging findings. At baseline and after 3 months of NE3107, patients obtained a multimodal MRI that included both structural and functional data. Today, I'm going to talk about 3 methods of looking at brain function: relative cerebral blood flow, blood oxygen level dependent imaging, or BOLD, and magnetic resonance spectroscopy. The relative cerebral blood flow and BOLD data were subjected to blinded review by 2 independent clinicians with a very high inter-rater reliability. Relative cerebral blood flow is a way of looking at blood flow throughout the brain. If you look at the images, yellow signal indicates areas that are more metabolically active, while the red signal indicates areas that are less metabolically active. On this slide, this is an example of a patient that had an abnormal signal at baseline scored by the clinicians. As you can see that there's a decrease of yellow signal in the temporal, parietal, or occipital region, and at follow-up, there was a return of yellow signal to that area, indicating improvement from baseline. With bold imaging, we are also able to draw a region of interest in one area of the brain and see what other areas of the brain are active at the same time. With a region of interest in the nucleus basalis of Maynard, a major producer of acetylcholine in the brain, a decrease of connectivity to the contralateral nucleus basalis, the ipsilateral nucleus basalis, the inferior frontal lobe, the temporal lobe, or basal forebrain were all scored as abnormal at baseline. On this screen on the left, this is an example of a patient that had a lack of contralateral connectivity and a lack of connectivity to the temporal lobe at baseline, as you can see in those red circles. The image below shows follow-up with a return of signal to those areas, indicating increased functional connectivity at follow-up. With a region of interest placed in the hippocampus, a decrease of connectivity to the contralateral hippocampus, the ipsilateral hippocampus, or the anterior mid-temporal lobe were scored as abnormal at baseline. On the right, this is an example of a patient with a decrease of connectivity to the contralateral hippocampus at baseline, and you can see an increase of connectivity at follow-up. We can also measure levels of chemicals in the brain using magnetic resonance spectroscopy. For example, we can look at levels of glutathione, a powerful antioxidant buffer in the brain. In patients with high oxidative stress, levels of glutathione are depleted. After 3 months of NE3107, we saw an average percent change in glutathione levels of 59%. This was also significantly correlated with the ADAS-Cog scores. In addition to the blinded review, we did a group analysis of the BOLD data. The default mode network is a network of brain areas that are all active when your brain is at rest. Literature has suggested that a breakdown in functional connectivity between the different nodes of the default mode may be involved in the early cognitive changes associated with Alzheimer's disease. With a region of interest placed in the precuneus, a major component of the default mode network, after 3 months of NE3107, we saw a significant increase in functional connectivity to other components of the default mode network. We also looked at hippocampal networks. Similarly, literature has shown that a breakdown in functional connectivity between the hippocampi may also be involved in the early cognitive changes associated with Alzheimer's disease. With a region of interest placed in either hippocampus, after 3 months of NE3107, we saw a significant increase in functional connectivity between the hippocampi. We also saw significant correlations between the neuroimaging and clinical outcomes. For patients that had a clinician-rated abnormal functional MRI signal at baseline and improvement at follow-up, this was associated with an improvement in ADCOM scores. In summary, this is an open-label study, but the findings we saw did align with our original hypotheses. NE3107 appeared to be associated with improvements in cognitive functioning, fluid biomarkers related to Alzheimer's disease and inflammation, and an increase in functional connectivity. Furthermore, the significant correlations between these outcomes supports this positive signal. The neuroimaging findings suggest that functional connectivity may be sensitive to change in a 3-month study, where structural connectivity or volumetrics may not be, and we believe this should be considered more thoroughly in clinical Alzheimer's research. Finally, I'm excited to share that a randomized placebo-controlled study of NE3107 in patients with mild to moderate dementia is underway. Thank you so much. Thank you to everyone at Bivi and the Regenesis Project for making this study possible. And a special shout out to my team at the Regenesis Project for being the most hardworking and supportive team. We'll all be hanging around here for questions after, so please find us. Thank you.